Welcome everybody. This is Don DeCostin from Charleston Southern. Looking forward to today's student and parent town hall. We're going to give just a minute or two to make sure everybody gets in the town hall. As a reminder, this will be recorded. So if you miss something, or if a fellow parent or student misses something, you can just let them know that they can go back and review it. So we'll give a minute or so, and then we'll get going. Thanks for coming. Okay, I have 5:31, so we'll go ahead and get started to make the most of your time. This is the second student parent town hall we've had, and the first one was recorded. So if you missed anything from the last time, you can go back and watch that. This one also will be recorded. Just as a heads up, we're going to move a little quicker today than we did the last time on purpose, since the other was recorded. We'll cover a lot of the same information, and we're doing that so we can leave plenty of time for questions that we can answer. So don't hesitate to ask any questions that you may have. And so really glad you're here. This is a unique year for all of us, clearly. You know, we are looking forward to the semester that's about to start. The pandemic task force has been in months and months of planning. And so they have evaluated this pandemic from, in our context, locally, looking at every single possible angle. We'll talk about a lot of those today. But just wanted to say thank you for your interest in Charleston Southern and for your involvement, your engagement. And we're looking forward to having your students on campus. I know some of you students probably are listening, looking forward to having you on campus. And this will be a different semester for everybody, but we are committed as safely and effectively as possible to do as much as we can to have an on-campus experience for as long as we can. And so as will be discussed along the way, all kinds of precautions have been taken. This is going to be shared responsibility. And what we're trying to focus on is we're talking really 3.5 months. You know, only God knows when a vaccine will appear. But we want to make sure students have the opportunity to have as an effective as on-campus experience as possible, which can be chosen really by the student, because the student can access classes. We'll talk about that. You can go in person, you can do hybrid, you can do online based on you know, your comfort level. And we want to make sure that you have the opportunity in this semester to make academic progress towards your degree, so that your life is not put on hold because of the pandemic. And so thanks for coming. The next slide will show kind of where we are and what we're going to be doing today. And so I'm going to make some introductions first, talk about the task force goals, and then Dr. Scheip will look at some data and some trends, which will be significant for all of us. And then we'll look at some other medical data that Professor Glover will cover. And then we'll talk about the specifics of our reopening plans, talk about some frequently asked questions already. We've had many, as you can imagine. And then we anticipate that you might have some that we haven't addressed, and we look forward to hearing those. Next slide, please. If you've seen the CSU magazine or a Facebook page, you'll see that I wrote a prayer because it was kind of how all of us were feeling. It's called Prayer of a Pandemician. So it's a made-up word it's a unique made-up word for a unique made-up time, and certainly in our existence. But the idea is a pandemician is someone who has endured a pandemic. And I think we can safely say we're not enjoying the pandemic. We are enduring it. Now, there are some things that we're beginning to get comfortable with, and some of those are going to have to happen here on our campus. We're going to have to get comfortable with taking care of our neighbors by wearing masks. Even if we ourselves aren't at any kind of risk, we don't know the kind of risk that others are at. And so we want to make sure that we're taking care by social distancing, by wearing masks, by doing all the things that would indicate that we are loving our neighbor as ourselves. And so to get us started, let me just pray. Father, we thank you for the opportunity that we have today to think about education. God, we know that education is your idea. We know that you have called us to live well and to live smartly and to grow in our faith. And we know that Charleston Southern University is a place where we, because we've been called by you to do so, where we integrate faith in learning, leading, and serving. It's a place where we prepare servant leaders to pursue significant lives. And God, we don't want to be put on hold. We don't want our students to be in a place where they have to wait a semester or wait a year or wait who knows how long. We're going to proceed in faith, but also proceed safely, knowing that we are following the guidelines that you have given to local health authorities, and we're following those guidelines safely and effectively so that we can do what you've called us to do in the best possible manner. And God, be with us from the time that we start classes until the day before Thanksgiving. When we end those classes, we hope to end them safely and well, knowing that we've done all that we can to glorify you and serve others along the way. Bless our time together today. In Jesus' name we pray. Amen. In the next slide, you'll see some MVPs. And the Pandemic Task Force is a group of about 40 people. Health experts, academic experts, student life experts, athletic experts, facilities experts, you name it. We've brought a team of experts together, led by Dr. Jackie Fish, whose picture you'll see here in just a second. But this team has been tasked with answering, first of all, can we come back safely? And if we can, how do we do that well? We're interested in two things. We're interested in opening the campus, which really is the easy thing. But the harder thing is keeping the campus open. And so that's what we're going to be talking about today, is how we do that well, knowing that this will not be, quote, normal, unquote, but it will be the best we can possibly do by keeping us as safe as possible to make sure we have an effective semester, leading students toward their academic, spiritual formation, and community building goals as best we can. Dr. Fish is no stranger to many of you. She's our Vice President for Academic Affairs, but she's also a nationally recognized teacher, instructor in disaster preparedness and emergency management. She is well known. She's a criminal justice professor in days gone by. She's a law enforcement professional, and she has a whole history that has equipped her to lead this task force well. You'll see Christine Palmer. She's Director of Public Health, and she'll be talking later today. And she's the one sort of managing the process, monitoring the questions, and she's making sure that we stay on task. And Dr. Michael Scheib, he'll talk about the data, and as you'll soon see, nobody does data better than the doctor. And so looking forward to that. Next slide, please. If there is an MVP from this point forward, it will be Professor Laurel Glover, who is our University Infection Control and COVID-19 Coordinator. She'll be the primary point of contact for students, parents, faculty, and staff. And she'll talk about how the process will work and how she will engage as students have challenges health-wise to make sure that students are safe themselves and are keeping others safe as necessary. And so at this point, I'm going to turn it over to Professor Glover.
Thank you all for taking the time to join us this evening. We're going to give you a little bit of an overview of our return to campus guidelines, and we are really looking forward to welcoming students on campus in the coming days. Our fall semester is undoubtedly going to look a little bit different this year, but we're living in quite a different world than existed last fall. But we really do intend to create a meaningful and academically excellent experience for all of our students. At the same time, we're working to safeguard the health of the CSU community as a whole. And to that end, we've consulted the agencies and the organizations that you see listed there. And in addition, we were able to consult with some other institutions of higher education, both in South Carolina and nationwide. We're really confident that our policies are in line with those other colleges and universities. On the next slide, you are going to see what we're calling our Bucksafe Pledge. Many of the infection control practices that do prevent COVID-19, they rely on self-accountability. And that is what prompted the Pandemic Task Force to create the Bucksafe Pledge. And every member of our CSU community, including students and faculty and staff, are going to be asked to commit to each one of these charges throughout the semester. So unfortunately, it's really impossible for us to guarantee that some of our CSU family is not going to fall ill during the fall. But we are minimizing risk in the ways that make the most sense while we can still ensure a meaningful college experience and an excellent Christian education. I'm going to turn things over to Dr. Michael Scheib now, and he's going to give you a quick overview of some recent data that has informed our COVID-19 decision making.
Good evening, and thank you for your time. So I'm charged with looking at some of the data on a national, global, and regional basis. So what we're looking at first is globally, the United States still ranks the highest in terms of the positivity rate. And that's one of the tests that you want to use to assess if a country is suffering a high rate of COVID-19 positive tests. Positivity is a ratio-based valuation. So if 1 in 10 tests turn out to be positive, that's a 10% positivity rate. If you do 100 tests and now 10 of those are positive, it's still a 10% positivity rate. So it's not simply the number of tests or cases, it's a ratio thereof. And the United States, although it has plateaued from a higher value, it's still around 10% across the United States at this point. Next slide, please. Another thing to consider is the importance of testing. Absent a vaccine, the best way for us to contain the virus is doing tests and having a quick turnaround time. There are many countries that assess and conduct tests in the hundreds for every positive case that they experience. The United States at this time is only conducting a test for 12 tests for every positive case. So you can see that's not anywhere close to the top 10 in the world. And when you know we are not able to conduct tests nor get those test results in a quick period of time, namely 24 to 48 hours, that puts the onus upon us as a staff, as students, and of course as the faculty as well, that we have to practice good hygiene, wearing masks, social distancing, and making certain that we're doing everything we can to reduce viral transmission, because unfortunately we do not have the number of tests nor the turnaround time in which to identify the positive individuals as quickly as we would like. Next slide, please. So looking on a national level, we are fortunately starting to come down for some very high levels that we've experienced recently. The cases for a 7-day rolling average are around 50,000 across the country. And this should be followed in a systematic fashion. Usually when someone is infected, it is a period of time, usually within 10 days, that they will express symptoms. And then if they have expressed symptoms that are severe enough, within the next 5 to 7 days, they'll be hospitalized. And then another 5 to 7 days after that, that is when the fatalities will arise. So from infection until a fatality arises is usually a 28-day time period. So you will notice the cases have gone up and they peaked and they're starting to come down. Hospitalizations lag behind that. And even further, you can see the fatality rate is still working itself up as the virus goes through its lifespan. Next slide, please. And it's also important to consider the risk for everyone. But we know the vast majority of the people on campus when the semester starts will be young. They'll be between 18 and 25 years old. And there is a narrative that young people don't have to worry about COVID-19. Young people do become infected with COVID-19. And when they do also experience some serious issues. Now, the seriousness of the issues is not as prevalent as it is for older people or people with other health issues or simply people who are older. But 1 in 5 people between the ages of 18 and 35 still have symptoms 3 weeks after they've tested positive, whether it be headaches, shortness of breath, or just general malaise. They still experience some long-term symptoms. So even young people are certainly at risk and need to practice good hygiene to avoid contracting the virus. Next slide, please. Now, when you're looking across regionally, the South has the highest positivity rate. In other words, when you're looking at roughly 12%, 12 out of 100 tests are positive. That is more than sixfold the Northeast. We're really experiencing our first large spike in cases. And at this point, the South leads not only, of course, the United States, it leads the world. Although the South only makes up about 2% of the world's population, it makes up about 24% of the cases. So the South at this time has experienced the highest positivity rate. And of course, we're in the South. So that underlines, once again, the necessity of us practicing good hygiene to curtail the viral risk transmission. Next slide, please. And you shouldn't be surprised when cases are that high that you are also going to see a larger number of hospitalizations. So the South makes up roughly 60% of the cases and also 60% of the hospitalizations. And last slide, or next slide, sorry. And then you can see this falls in line. They also make up the highest percentage at this time of fatalities. So there's a nice streamlined connection between the cases, the hospitalizations, and thus the fatalities as well. Which you say, hey, I don't want to see that. I don't want them to be connected. The more we know and the more we understand about this virus and that it follows a pattern in which we can predict, the better we will be at containing it going forward. And so we have to learn as much as we can, as soon as we can, so we know the practices that we can pursue to prevent it as much as possible. And next slide. So locally, South Carolina has experienced very much what the South has looked like. It's hit a peak in the last 2 weeks, and it's starting to come down in terms of the cases and the hospitalizations, but still note those hospitalizations are as high as they've ever been and close to threefold what they were at the beginning of June. And the fatality rate, fortunately, has plateaued as well and is starting to see a decrease. And we hope that decrease continues for the next month. Next slide, please. And to give you an idea of locally, the South Carolina positivity rate, was once around 18 to 19%. It is starting to drop into the 12 to 14% average for the last 7 days. So the thought is that measures have been put in place. More people are wearing masks, more people are practicing good social distancing, and that is coming to fruition and lowering the positivity rate. In many other countries, they have been successful in containing the virus. They don't have a vaccine, they don't have anything special that we don't, but they have greater adherence to proper hygiene that's helped them curtail the virus more so than we have. And now the last slide, please. And to give you an idea, what I'm most concerned about here when we look at the different columns of values is the occupation and ICU. When you have individuals with COVID-19, they can experience some very significant symptoms which require being admitted not only just to the hospital, but the ICU as well. And you can note all throughout the South, aside from Nevada, there are plenty of states that are dealing with a very high ICU occupancy. Now, if you're not familiar with the ICU, typically it's not considered to be elevated until it gets to 80% or higher. So in essence, there's a 20% margin, in other words, opening of beds at this time. And you can see South Carolina is right on the border of that. And we're keeping a close eye on that to make certain that it doesn't get into the overly extended range, which it should not happen, as we have seen that the hospitalizations are starting to go down at this point. All right, thank you.
All right, so in addition to that national and that worldwide data that Dr. Shipe summarized for you, we've been in really close contact with our healthcare partners right here in the Tri-County area. So the numbers that you see on this slide, they represent inpatients at our major area hospitals, and each of these patients was admitted for COVID-19. So we've used this data to help inform our decision to reopen. And I've provided for you both the numbers of inpatients as of yesterday and the numbers that were in our presentation last week. So you can see that there has been a decline in hospitalizations, and we certainly pray that that persists. If you were with us last week, you know that we covered in detail the many plans that CSU has put into place for reopening. So Dr. Palmer and I are going to briefly touch on those topics again, but if you want to look at them in more detail, I would encourage you to access the recording of last week's town hall, and that's available on the CSU webpage. We're going to be screening all of our CSU community members using the LiveSafe application, specifically the daily health check, and it will ask users to identify any symptoms, any circumstances that would make it unsafe for them to report to campus or to leave their dorm room. Our classrooms, our computer labs, our common areas, our gathering spaces, all of those have been modified to allow for social distancing, because we know that's one of the most effective ways for us to avoid person-to-person spread of this virus. We are requiring that all individuals on campus wear a face covering. Students are going to be given a Bucksafe mask at the start of the semester. In our Return to Campus guide, you'll also find several resources for the appropriate ways to wear a mask, as well as how those items should be laundered. Hand hygiene, hand washing in particular should really be emphasized in all settings, not just on campus, as we combat COVID-19. So we've equipped the CSU campus with hand sanitizing stations. Cleaning, disinfection has been enhanced across campus. We're really focusing on high touch surface areas, things like doorknobs and sink handles. We do have professional cleaning and disinfection services in place, in particular for our isolation rooms. And we will ask students and faculty members to assist with some of the cleaning of classroom surfaces when they enter and exit and use items like desks. Lastly, we've established really clear protocols that are influenced heavily by CDC guidance, and we'll use those in the event that an individual does become sick while they are learning or working or living on campus. We have 80 beds available for residential students in isolation, and isolation intends to separate sick people with a contagious disease from people who are not sick. Residential students will also have the capability of quarantining in their dorm rooms. Quarantine is different from isolation. It separates, it restricts the movement of someone who is potentially exposed to a contagious disease, and we wait and see if they become sick. Now, local residential students, they do have the option to quarantine or isolate at home, as long as they can get there via a private vehicle. And Dr. Palmer is going to talk about that just a little bit more.
I'm going to take a few minutes to talk about our approach to sick individuals, and then also some of our major areas on campus, how we're handling those. So as Professor Glover said, each day, faculty, staff, and students will have to complete a screening in the BUCSAFE app. That app is now functional on our campus, and you will either get a green check or a red X to say you can come to campus. So if you report on the BUCSAFE app that you have one or more of the symptoms of COVID-19, and there are 11, then you will not be permitted to come to campus or to leave your residence hall. So if you are a commuter student, and this also applies to our faculty and staff, if they could potentially have the virus, they would be asked to stay at home, and that would be described in the red X. If you live on campus, you'll be asked to stay in your residence hall, and we already have plans in place to make sure that meals are delivered to you and that you're getting everything that you need while we wait to see next steps. You will coordinate with the university COVID-19 coordinator, so she's going to be triggered an email each time someone receives a red X, and she will reach out to the individual students to determine next steps. So when it comes to academics, as you can see in this picture here, this is an example of one of our classrooms that has already been outfitted for social distancing. So as you see, students are 6 feet apart, and in this particular classroom is done with tables. So every classroom will be configured to be 6 feet of social distancing. Students will be required to wear masks in the classroom. We're also modifying our academic calendar. So classes will begin in close to 2 weeks, Wednesday, August 19th, and then they will resume or end right before Thanksgiving. We have also installed plexiglass barriers for each of the faculty members to teach behind. This allows you to be able to see the face of the faculty member as they're teaching, because that is important, especially because each class is being recorded. So that ensures that you'll be able to understand them while it's being recorded. So they will remain behind the plexiglass barrier while the students are sitting at their desks or tables. Students, if they cannot attend in person, whether that's because their personal choice, they're not comfortable, or they are high risk, or if they have to go into quarantine or isolation during the semester, we'll work with their professors for virtual attendance. When it comes to housing, so we now have limited each dorm room to 2 people to a room, and that means 4 people sharing a suite with a bathroom. We are also staggering our move-in times across several days to ensure that we can allow for social distancing inside of the residence hall during move-in. And so we don't have backups of people waiting for elevators and things like that. We are asking that students only bring 2 helpers per resident. So essentially the guardians, or it could be an older sibling, someone that can help with the move-in process. And they should make sure that they do not have symptoms when they report to campus to help with move-in. We will not be allowing guests in the dorm rooms for the duration at this point, and that is to protect our students on campus. So we will not have visitors in the rooms. We also, and you should have received correspondence about this already, if you are living on campus, that you will be required to have a negative test. That means a negative viral swab. That means you are not currently infectious, or a positive antibody test. That means that you currently have built up antibodies to the disease because you've already been infected. So one or the other will be required of all residential students within 14 days of move-in. So that's really, at this point, we are already hitting that kind of timeline of past the date. So you would have to do it within this time frame. And that's to allow, we know that in different places around the country and around our state, we need to allow for some more time for you to get the test results. For dining, so Aramark has done significant planning to support our social distancing in the dining hall. We've reconfigured the occupancy, reconfigured the food lines. There are now markings on the floor so that you can see what 6 feet apart is standing in the line. They've established ways in and ways out, so they are having a safe place for the students. They're also, in addition to the in-room dining hall, there will also be grab and go options. So there is a tent that is being set up so that you can eat outside. We're also going to have places such as the Gold Room, Java City, which is our coffee shop where people can go. And again, we will also have it set up where our dining hall will provide meals 3 times a day for our students in quarantine and isolation. For student life. So now for this one, we understand that student life is going to look different across this campus for the fall, but we do want to be intentional to make sure the students are still getting a great CSU experience. Chapel will include virtual options for the fall. So if you're not comfortable or unable to attend chapel in person, you will have the option to watch it virtually. Student life activities are being adjusted so that we try to prevent having very large gatherings. There will still be events. There will still be opportunities to get together with friends. We're just going to make sure they're done in a safe way. Our Sweet 16 calendar, which is our very popular events, is being adjusted where a lot are being moved to the spring, but we will still have a few later in the fall semester. The Brewer Center, which is our gym, will open with limited capacity. They did open already. They're having limited capacity, social distancing, required masks when entering the building, and enhanced disinfection practices. So it is open and allowed to be used at this point for on-campus students who are currently living and for our current people working on campus. We will reopen the Brewer Center for the remaining students when they move onto campus or when classes start. Campus recreation and intramural sports will also be modified for this year. There's a lot of exciting talk about new intramural sports that can be brought in that will allow for social distancing, but that can also be fun for our students. Now I'm going to turn it back over to Professor Glover to talk about our exciting news for student health services.
Yeah, last week, we were able to announce a partnership with Fetter Healthcare Network. And Fetter Health is going to provide medical services to students and faculty and staff. Fetter will physically be present on campus in their mobile medical unit every Wednesday. And then on the other days of the week, students can actually seek out healthcare services at one of Fetter's many locations in the Tri-County area. So we'll be releasing more information about this partnership as it becomes available and as we begin the fall semester. So we're going to do our best to answer some of the frequently asked questions that we've seen several times, and then we'll also address some of the questions that you have been entering into the Q&A.
Yeah, so one of the most popular questions is what will be the attendance policy for the semester? So if you've been at CSU before, you're familiar with our FA or fail for attendance policy. That policy is suspended for the fall 2020 semester. And that is to make sure that we are not penalizing students who do need to stay home for various reasons or who do have to go into quarantine or isolation. We don't want students coming to campus who may be sick just because they have to check off their attendance and don't want to fail for that. So that is suspended attended. We've also reviewed our courses to identify those that can be successfully taught online or successfully taught in a hybrid format, which allows us to do social distancing. So those have already been done. Your calendar, I know there have been questions about when that will be accurate in MyCSU as you're seeing some shifts. At the beginning of next week, your calendar should be correct in MyCSU. All right, how will classwork and tests be administered? So this is going to vary from class to class, but we do want to ensure that as little as possible, we have paper sharing. That we are doing is encouraging electronic submission of quizzes, tests, and assignments. There are various tools that we have at our Access with Blackboard that allow for lockdown of the screen, which ensures that students are not accessing materials online. So those types of things will be utilized for electronic submission and trying to limit the use of paper.
All right, one of our more frequently received questions is whether an entire class is going to need to quarantine if they find out that someone in that class becomes sick. And the answer is no. If social distancing guidelines are followed, no one in the class would actually need to quarantine. When someone on campus demonstrates symptoms of COVID-19 or tests positive, we're going to work quickly to identify any close contacts that they had in the 48 hours prior to the onset of symptoms or prior to that positive test. And close contacts are people who were within 6 feet of the sick individual for 15 minutes or longer. Only those close contacts need to quarantine. So remember that that quarantine period is 14 days from the time of exposure, and that's the period where we are watching and waiting to see if somebody who is exposed to the virus develops symptoms. So I do want to note that we're going to contact all close contacts of students, faculty, and staff. So if you don't hear from someone on the infection control team, you weren't exposed due to an incident that we have identified and are investigating. At this point, we're going to take a stab at some of the questions y'all have submitted through the presentation, and Dr. Palmer is going to moderate that process for us.
Yes, it looks like a lot of them are being answered for us already, which everyone's doing a great job of managing our Q&A. So if you have more questions that you are thinking of as we're kind of wrapping up our talk, please feel free to submit these and we can talk about them now. I think one of the questions that was good is starting on at home, transitioning on campus later during the semester. I think this speaks to why we're going to be working with each individual student and each individual professor to make sure that they have what they need to be successful in their courses. All right, so we have here talking about the air filtration systems or UV lights. So we're looking at kind of our environmental health capacities that we can look at. Professor Glover, would you like to talk a little bit about HVAC transmission and the risk of that?
Yeah, so right now we don't have any plans to install air filtration systems or UV lights. However, the primary risk from COVID-19 is from respiratory droplets. And you're exposed to another's respiratory droplets when you're in their bubble, when you're in their personal space. And this is why physical distancing is really the most prudent way that we can minimize our risk of infection.
Great. I also saw the concern we're talking about if you have one or more symptom that triggers an isolation and what is our capacity. So as Professor Glover said, we do have 80 beds for isolation. Isolation is once we are already confirming that you are sick. So just because you have a red X one time does not automatically mean that you'll be going into isolation. That just triggers to us like there might be something going on and we need to reach out to you and find out. It could be that you have a headache and you drink a glass of water, you were dehydrated, and you're fine an hour later and you would be released back. What that would trigger is a quarantine, meaning you would be asked not to come to campus until we can find out how you're feeling. So we don't expect that we would have mass numbers going into isolation at one time. Another question, a good one about visitors on campus this semester. Dr. Fish, would you like to speak to that on the visitor policy?
The visitor policy, it's a little confusing. I've seen a lot of questions about that they're confusing move-in day visitors. with normal visitors. So move-in day visitors, you're allowed 2 to help you move into your room. And they do not have to have a negative test results to come on campus. And visitors will be scheduled only by appointments in terms of if we can possibly help you via Zoom, we're going to do that and try to move people in quickly and get appointments scheduled rather than bringing people face-to-face in smaller spaces.
Yes, so we also have a question confirming what I said about My CSU, correct. So at the beginning of next week, you should be able to look online. You'll be able to see where your classrooms are being held, the ones that are in person or hybrid, and you'll be able to see which ones have been moved online. So that should be accurate at the beginning of next week. Classrooms being properly cleaned, yes. So we do have protocols in place for the cleaning of the classroom at the end of each session. That will require some collaboration between all of us to make sure, students will have things to wipe down their desk so that everyone's going to kind of play their part so we can get in from building to building and class to class. But yes, we do have protocols in place for cleaning, and we have all the supplies that are already being unloaded into our classrooms now. All right, so a good question about a smartphone. If someone does not have a smartphone, there are still options for how to do Live Safe. So we do know sometimes that happens, that someone breaks their phone or loses their phone and they may not have it when they're coming to report. You can access Live Safe online. You can log in through the internet. So if you have a tablet, if you have a laptop, or we will work out something to go into the library to complete it, where we can ensure if you have a situation, a rare one, where you do not have an option to complete it. A great question. Can students leave campus to go to places like work and church? Professor Glover, would you like to answer that?
Yeah, so we don't have any restrictions right now on students coming and going from campus. We know that y'all have to get to work. You may have plans to visit your family on the weekend. The only thing that we ask is that you remember that the choices that you are making off of the CSU campus have the potential to affect all of us on the CSU campus. So when you're traveling, when you're going to work, to church, if you have social engagements, just remember that we really want to minimize the risk of infection so that we can be on campus and we can stay on campus as long as it's possible. And your decisions really have a lot of influence on our ability to do that.
Great. We have a lot of great questions coming in. So talking about the assignment of online classes. So I know this is a concern for students, that they're afraid that they may have an in-person class at 9 a.m. and then they have an online class they need to log in for at 10, and then another class at 12 in person. So the good thing is most of our online courses for the fall are considered asynchronous. So asynchronous means that you are not required to log in and attend class at a very specific time. It means it's set up in a module format where you have deadlines of things that you have to do each week, but you're not required to log in for a class time. There are some synchronous classes that will be required on campus, but the vast majority of the online ones are not. So you should not find a lot of issue with that where you are in person then having to shift online. We will be having additional outdoor space, those tents. So if you do need to find a space in between classes, if you do have a lag of time and it's outside the dining window, you're welcome to use those types of areas on campus. We have a question about the maximum amount of positive cases. So this is kind of getting into our question, our trigger points for contingency planning. We don't have outlined saying once we hit this number of positive cases on our campus, we will close. In our campus reopening guide, we have some clear guidelines of what we're following. And it would make a big difference on the number of residential students versus non-residential students when it looks at our capacity to make sure they're well. Professor Glover, if you would like to address that further. And we also have a good question about seasonal allergies, because I know this can make it confusing.
Definitely. So in terms of those trigger points, we're really going to be monitoring several different things that would render it unsafe for us to continue to meet in person. So that's something that the University Pandemic Task Force will be reviewing on a really on a daily basis, so that we can ensure that we can continue to provide safe instruction. So while we haven't set a specific number, we are looking at things like that positivity rate that Dr. Shipe shared earlier. We're looking at the capacity in the area hospitals, how full are our ICUs, how full are our hospitals in general. We're looking at how many students we are housing in isolation, how many residential students we have in isolation. We're also monitoring the health of our faculty and staff to ensure that we can still provide instruction. So certainly is on our radar, those trigger points are, even though we haven't set a specific number of cases that would cause us to return to fully remote instruction. The question about seasonal allergies is a great one. So we definitely want you to be completely honest and forthcoming when you do your daily health check. Basically what would happen if you indicated on your health check, well, I have a headache and a runny nose, you're gonna get a red X. It's gonna tell you, don't come to campus, and I'm gonna reach out to you, or a member of our team is gonna reach out. You're gonna say, hey, I have seasonal allergies. This is not atypical for me. This is how I feel on a daily basis this time of year. And then you'll be able to go about your scholarly pursuits without being interrupted due to the need to isolate. So again, it's just a matter of us establishing that communication and learning what's appropriate for you and what's not. So you're certainly not going to be asked to isolate for 10 days because you have a scratchy throat when you have seasonal allergies that you deal with every year.
And the great thing is we currently do have a small number of residential students right now. We have some of our student athletes returning, and they are all currently using this LiveSafe app. So we have gone through this. Professor Glover has seen this already. So this will not be a surprise for us when we have more students move on campus and we have our commuter students back. All right, at this point, we have all of our questions are considered answered. So if we have more, feel free to send them in.
Yes, and again, this is being recorded. So if you want to go back and review, or let some of your friends know, others who weren't able to participate, they'll be able to review the recording as well. And so we're just so looking forward to this semester. It's been something that we've been anticipating, you know, with great anticipation. I can't sing the praises enough of the Pandemic Task Force. Trust me when I tell you, they have examined this from every possible angle. They have taken often conflicting medical advice and gotten to the nub of what applies to us in our context. And we have every intention of starting on campus, and as students need to do hybrid classes or online based on your own preferences, we plan to continue for as long as possible, which we hope is all the way to the end. As you probably will remember, our intention is to finish the day before Thanksgiving. And so we're going to go all the way through then. And so when I speak to the students, what I probably will, I'll talk in terms of this semester, as unique as it's going to be, it's about the length of probably Marine Corps boot camp. Okay, and so this will be a little better than Marine Corps boot camp, but it will give us a sense that we have to do some unusual things, some unique things, some out-of-the-box things as we inconvenience ourselves for the sake of accomplishing this very important goal, so that we can have safe and effective education, spiritual formation, community building, and so that this semester isn't a wasted opportunity, however you decide to do it, whether it's mostly online or mostly hybrid or mostly face-to-face, depending on the schedule that you have. And so we will do the best that we can by far. We're excited about what's going to happen. And our plans are flexible, and we will not hesitate to always act in the best interest of the safety of our students. Again, keeping in mind that our goal is to produce academic excellence in a Christian environment. And so I see another question, a question on the screen. And so we'll just do those until the questions stop coming. We're not in a rush, but when they seem to stop coming, we'll bid you all adieu. But so thanks so much for being here tonight. Looking forward to having you on campus.
All right, we have one about temperatures being taken before entering class. Professor Glover, this is an opportunity to talk about what we're finding interesting with the college student population when it comes to fevers.
Yes, so again, interestingly, as Dr. Palmer said, the CDC is not recommending temperature checks as a means of infection control, particularly for college campuses. And this is because many of our college-age students become symptomatic and remain fever-free. They are afebrile. The majority of young adults, so late teenage years, roughly 18 to 24, will not develop a fever while infected with COVID-19. And in addition, in patients older than that, we aren't routinely seeing fevers. Now, certainly, if we have a member of the CSU community that has a fever, we do not want them to report to campus. And we define a fever as a temperature of 100.4 or greater. And that is one of the questions that the LiveSafe app will ask when you complete your daily health questionnaire. So if you have a fever, we certainly don't want you to come to campus, but we will not routinely be checking temperatures when you enter the classroom. And I see another question I'll just go ahead and answer while we're talking about the LiveSafe app, about how it will be validated every day. So to enter our facilities, whether it's the dining hall or the library or the Brewer Center or your classroom, you're going to show your big green check mark on the LiveSafe app. It has your name on it. It's also time and date stamped. So you'd have to redo the check every day. And you'll have to show that green check mark to gain access to our facilities.
All right, we've had a couple financial questions here, and here's one specifically asking about a breakdown. I'm believing about tuition and fees. We unfortunately cannot address specific financial aid concerns, nor any of us on the call actual financial aid representatives. So we're going to direct you. Financial aid will be happy to answer those questions for you, and maybe someone can shoot in there the phone number and the email address for financial aid for that particular question so they can get those answered. All right, we have one, Professor Glover, asking about, can we have a printed paper from LiveSafe if we don't have a working smartphone? So this is a good time we can talk about how these are time-stamped.
Yeah, as long as, and it is, when you complete your screening, you get that green check mark or your red X, and it is time and date stamped. So it will have your name clearly on it. It will have the date and the time you did your screen. So you can certainly print that out and use it to access the facilities. Just be aware that you would have to print a new one each and every day. And I'd probably print it in black and white too, because it would use up all your green ink in your printer.
Okay, for the sake of time, again, we're not, oh, good, more questions. Again, not in a hurry, just didn't want to waste your time. And so please fire away.
Oh, it looks like there's a question in the chat that says, you know, where can a commuter student take synchronous online classes? So I do want to note that some of the areas that previously have been available to commuter and residential students are going to have limited capacities. You can certainly go in the library to attend a synchronous online class. I would suggest that you probably bring headphones for the library. That's one option. We also have added 2 very large tents connected by 4 tents outside of the Whitfield Center and the dining hall. So that's another place that's available for a commuter student that maybe wants to get online and do a synchronous online class.
Okay, so we have a question about really asking about the enforcement of social distancing and wearing masks. I mean, we'll have to keep in mind this is a community effort. Certainly campus security will not be in every classroom to ensure. So some of this is going to be community effort. Dr. Fish, would you like to speak a little bit more about our policies?
I'm sorry, Christine, I was looking at the next question. The policies regarding.
Will campus security be involved in making sure that students are social distancing and wearing masks?
Now, this is primarily a student responsibility. We're asking the students to take responsibility for their health and everyone else's. So we expect that the social norm will be very soon. Everyone will have on a mask. And if you don't have on a mask, one of your friends is going to ask you, why don't you have on a mask? Why are you putting me in danger? So we're not, this is not something that the police have time to worry about. This is truly a social responsibility for each individual.
And I would add, you know, it may be that as we proceed that, you know, a certain student may just find that they simply, you know, them and mask don't go together. And so what we would ask then is the other alternative is that they would, you know, move to more of an online approach for their classes, just so that we're trying to balance the needs of every student. And so, you know, that'll come in time. And, you know, we've all sort of gotten used to wearing masks. It's nobody loves it, but we do what we have to do. And again, we're all certainly hoping that this is a one semester deal. But we'll be prepared for next semester if that's the case. But you know, we're looking forward to Thanksgiving, and all of you, I would implore you to continue praying for a vaccine or a miracle removal, miracle cure. I'm for either of those, and so it's a great question. Okay, thanks again for your time tonight. Again, we wanted to do one that was later in the afternoon, so those of you who might have had to work during the other times, you know, could participate. And at any time, and we mean this, you know, we have a team of people, principally Professor Glover, who is monitoring the COVID-19 email address. And so, you know, please ask the questions, because the questions that you ask can help other people too. We think we've seen and heard everything by now, but we're surprised periodically as well. And so no question that you ask is going to be out of bounds because it's going to help us think through our approach. And I'll just reiterate, we're looking forward to the semester. Our plans are flexible based on safety, and we're not going to take our eye off this ball. And we certainly hope that nobody on in our campus community does as well. You know, when the students arrive and the rest of us as well, you know, we think we have a pretty good handle on what's going to happen on the campus because of the social norming that Dr. Fish mentioned just a second ago. You know, if we have a concern, frankly, it's the concern of what happens when students and others are off campus. And so we would ask, and we're going to ask strongly, that everyone would maintain the same kind of safe practices off campus that they do on campus, because we want to maintain an open campus for as long as possible, which we hope is all the way through the day before Thanksgiving when the semester ends.
So we did have a great question come in at the very end asking for additional questions. So the webinar will end, so you will not be able to type in questions to this chat box, but we do have the COVID-19 email that should be on there for you now, that you can email any questions, covid19@csuniv.edu, for any questions that you have.
Okay, thanks so much for joining us tonight. We look forward to seeing you on campus. God bless you. And until then, stay safe. God bless y'all.